Hey, good afternoon. Pat Ziemer here with MagnaWave. Sorry for the delay today. Had some issues that we had to deal with that kind of put us back a little bit. So again, I apologize for being late, but we're here. So if you have any questions, we're here to answer your questions. We come to you on Tuesdays to do just that, to answer your questions, whether it be about protocols, machines, training, anything that you want to know about. We're here to try to answer your questions. The Marine's with us, Northern Lights is with us. So we'll get some folks hooked up here and we'll be ready to go and get your questions answered. Please share this broadcast with your friends. They may have questions that they'd like to have answered. So we're here to want to take care of that as well. If you'd like to talk to me personally, send me a text to 502-414-3436. That's 502-414-3436. And I will give you a call back and we can have a conversation again about whatever it is that you would like to talk about. So we're certainly here ready and wanting to do that. Leilani's with us, Beverly's with us, LTC MagnaWave Services with us, Joanne's with us today, and Rob is with us as well. So we'll continue to build on those numbers as people have questions and we can go forward. There are a couple little things. As you know, next year we got the MagnaCon coming up in June. It's going to be at the Galt House. We've signed all the papers, but we don't have the rooms yet. They haven't given us the link to the rooms. I just verified that this morning. So you can call and order your tickets for the MagnaCon, save $100 if you do it by the first of the year. You need to do that, but do not call the Galt House to order your rooms, because when we get the block of rooms, the rates will be better. We'll all be in the similar type of area in the hotel. So just hang tight for that. We'll send you an email, post it in the practitioner page, post it on the corporate page as to that we have the room block available, and you'll be able to go in and get the discounts accordingly with the rooms that you'd like to have at the Galt House. It's really going to be exciting, right downtown in Louisville, right on the river. The live demonstrations are going to be on what they call the Belvedere. So we'll be outside right at the river, being able to see what's going on. So it's going to be a great time. Certainly we're going to go to Churchill Downs, and the nightlife in Louisville is wonderful. A lot of good places to go, museums, the Muhammad Ali Museum, the Hillary and Bradsby Baseball Bat Museum is there. The Fraser History Museum is downtown. And so we're excited about all of that and those locations that you'll be able to enjoy. So again, save $100, order your tickets now before the first of the year, and you'll save $100 on your ticket. Also, as you know, the holiday cards are available for you to have, and we would like for you to get those if you want to have the holiday cards personalized. Let's see, are we beyond the personalization date? Yep, December the 5th. So we're beyond the personalization, but you can have the cards, put stickers on them, sign them, whatever you like to do. $100 for 25 cards. And as you know, the video books are in that have videos by discipline available. And so they're available for the practitioners. If you'd like to know more about that, call your product specialist or call support or call the office and ask for support, and they'll take care of you with regard to the video books. All right, we have some questions that were presented. Let me see if I can pull the questions up here. Question is, have a horse that has been on stall rest for a year for tendon injury, and at a checkup, there's still a small fracture that isn't healing as well as the vet thought it might. She'd like me to MagnaWave. Has anyone done sessions on something like this? Terry asks. Most certainly. There's always situations, or there's times when something just does not heal all the way and just needs that little extra boost. And certainly the MagnaWave PEMF with the blood circulation and the oxygenation, it was first approved for non-union fractures as an FDA device where the bones would not totally heal together or heal back tightly and knit properly to come non-union, meaning they weren't touching. And so you're dealing with a situation like that for whatever reason. Could be just a movement of the horse, just as enough there that it just does not allow it to heal. So if you get something to boost that up a little bit, it would be something certainly to try. And we've had a lot of situations like that where we help push an animal further along in their healing process. Okay, another question. Person has a personal horse that has a slow healing eye ulcer wound. Would MagnaWave treatment help with this? Most certainly you want improved circulation into the eye, into the ulcer that's in the area, and to, again, help the healing process be enhanced. We basically set the area up with good, healthy blood cells, good, healthy cells in the area that are more designed to do, or not designed, more capable of doing what the intention is for them to do. So to treat that area, simply take the coil, put it right over the eye, make sure it's very moderate in treatment. Very low in the type of treatment that you're doing, and treat it for 6 to 8 minutes daily, or a couple, 2 or 3 times a week, whatever you feel comfortable with doing that, and it'll work out hopefully very well for you. So certainly there's been a lot of times that we've used MagnaWave to enhance those types of situations. Okay, my personal horse has a fractured left side of her jaw. Unknown how exactly she managed to accomplish this. Now, I understand. Advice on the guidelines, how to address this. Well, certainly you want to treat the left-hand side of the jaw. You can take the large loop and put it up the muzzle, basically, and treat it over the area. You can take the paddle or the butterfly loop and put it on that side of the head and treat that area to help, again, enhance the blood flow, enhance the oxygenation to the area, to allow the body to be in a position to better heal itself and to promote that type of healing to the area. So it certainly would be something to reach out for. And that's another one of those areas that, with their head movement and their eating and everything they're doing, makes that a difficult area to just heal up the way you want it to. So just providing that extra energy to the area may prove to be very beneficial to help process the healing functions in that particular area. Okay, so we have a question here, and they're talking about, this is a personal question where a doctor is talking about some medication that's been given, and they've said do not MagnaWave because they've seen studies where the MagnaWave makes the medicine not work. Now, if something's an inhibitor, if something can be dispersed, if you will, by virtue of our type of therapy, then certainly you want to not do that, and you want to always follow the direction of your doctor or your veterinarian that you're dealing with in these particular situations. The only thing that I would question when someone says, I've seen a lot of studies that say that the PEMF or the MagnaWave stops or prohibits something from working, my number one question, and I would encourage anyone to ask this, would be, can you tell me where you read that? Can you direct me to the studies so we can see what is being discussed? Because there's not a lot of studies. And so if you're going back and someone is picking up on some studies that have been done years ago with various different types of equipment at different strengths, so on and so forth, then we'd like to see that so we can have our doctors look at it, our internal doctors take a look at it and understand what they're saying, so we can come to you, the practitioners and the users, and better explain what someone is saying. To have someone say, oh, I've seen studies that say this doesn't do that, and then we say, okay, what are the studies? And please direct us to those so we can learn and be better educated about that. So if you find yourself in that situation where that's an answer that someone gives you or a directive that they give you, certainly follow their directive, but always ask them for the support that they're bringing to you, so you can go back, and so we can go back and help you and help everyone understand that. That would also be a good function of the AOPP. The AOPP would certainly like to get into that situation and do their research so they can then justify or understand what someone is saying. We always want as much documentation as possible so it can be supportive of what we're doing or what we shouldn't be doing if there's a question about how to use a device with a particular medication or a particular condition that someone or some animal is experiencing. So I hope that helps there. You always want to follow your doc. You always want to talk to your doc, but also don't be afraid to say, okay, you saw the studies. Can you please direct me to the study? And we can go accordingly. So there you have it. So if you have any questions, simply post them and I will certainly try to answer them. Let's take a look here and see what questions have been presented. Hello from Atlanta. Good. Good morning from Arizona. And here, Merry Christmas, everyone, from Rob. Thanks, Rob. We appreciate that very much. Get your early bird tickets to MagnaCon today. That's a post that's up there. So we can, Gainesville, Texas is on board. And so we're excited to have everybody with us. I don't see any questions. If you have a question, please post it in the chat box, and I will certainly have a look at it and answer the questions for you as best I can. Let's see if we've had anybody reach out with a text for a callback. Nope, nothing's there yet. So I had no calls to return at this point. So if you have something for me, please post it accordingly and I will do it. Trinity asked the question, is it possible that we use MagnaWave or the LZR would make someone's wisdom teeth break through sooner? Also, best recommendations for pain reduction incoming wisdom teeth. Well, I don't know that using the PMF is going to cause them to come earlier. There is pain certainly sometimes associated with wisdom teeth that are coming in, and which is caused by inflammation, caused by what's going on in the growth process. So to make that more comfortable could certainly be something that could be approached. Again, you always want to talk with your doctor and make sure the doctor understands what you're dealing with. Dr. Marty has talked about his own tooth processes, the wisdom teeth that he had pulled over the years, and how he treated himself and relieved the pain, made it more comfortable, improved the healing process that he was experiencing. I did the same thing when I had my wisdom teeth pulled, 4 of them at one time. Quite an ordeal, and talked about it with my doctor. He suggested that I give it a try and use it, and the results were very good from the standpoint of pain relief and faster healing process after the procedure. Coming in, you have the same thing. You could have that in an animal, where they could be having some jaw pain or tooth pain from teeth growing or from an issue that they're having, that you can treat the area, and again, help reduce the inflammation, help the situation feel more comfortable and more tenable to the client that you're particularly dealing with. Great question, Trinity. Appreciate it very much. So if you have a question, simply put it in the chat box, and I'd be happy to answer it for you as best I can. I've got a new camera that's right in the center of my screen, and I find myself looking up at where the camera used to be, so it looks like I'm looking up. I keep forgetting that it's right here in the center of my screen. Let's see. Can you touch on frequency versus intensity on MagnaWave machines? I had a chiro ask about this. I need a brief, succinct answer. When we talk about frequency, see, there I am looking up again. When we talk about, right there. When we talk about frequency, we're talking about how frequently the machine fires, or how often you get the signal to be delivered. So it's the clicking portion is the frequency. Is that 4 per second? Is that 1 per second? Is that 25 per second? Or however the speed is that you're looking for. 1,000, 1,001, 1,002, 1,003, 1,004, 1, 2, 3, 4, 2, 2, 3, 4, 3, 2, 3, 4. You can count that and understand. But frequency is not a radio frequency. We don't turn it to 27.5 frequency, but we can deliver, and you can learn this as you practice yourself and deal with the devices, how many clicks you're getting, and that's your frequency, how often it fires. And that's the question that people always want to talk about. Intensity, on the other hand, is how you turn it up. Now, as we turn our devices up and it goes higher, they actually click at a slower rate, or the frequency of the delivery is slower and it's more intense. So the slower our frequency, the more intense the signal. Doesn't mean that it's not passing through and going deep into the area. It's just the intensity that's being felt. So the faster the signal, click, 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 is the higher frequency or more frequent delivery, but yet the intensity is less. And you'll have that on specific types of injuries. When I did my MCL on my left knee here now, I don't know, 7 weeks ago or so, when I was first treating it, I would put the butterfly right on the area of the injury, and I treated it on a 4 or a 5, very fast, very low, because it was more comforting to the area. As it is healed, and what I've done now is I'm using the large loop, draping it over my knee, and I'm putting it all the way up. So I'm putting more energy into the area, but not as punching to the area. If I use the butterfly at the higher intensity, sometimes it would be a little irritating. So what I wanted to do was turn it down low. And as we know, the tissue responds when you change it up, when the tissue is not used to what it's going to be getting. So today, do it on a lower setting, faster frequency, that's a lower intensity. And then tomorrow, turn it up a little bit so the intensity is a little higher and the frequency is slower, and you can go accordingly like that. So I hope that helps. But the frequency is the speed of delivery. How often the signal fires is how we measure frequency, or we talk about frequency. Intensity is the amount of energy that's put into the area. Now you can take that a step further and talk about the spark chamber devices and the digital devices, whereas they're a little more comfortable on the digital devices, so you can turn them a little higher to where they're more comfortable to the client and to more comfortable to the animal, and supply more energy at a more comfortable area. Whereas sometimes on the spark device machines, when you turn it up to get a little more intensity, it can become a little uncomfortable when it's delivered. So you turn it down and to make sure that it's comfortable. Are you getting the same amount of energy? No. And so you want to be able to think about that as well. I know I've covered a lot of stuff there, but again, I'll do it one more time. Frequency is the rate of delivery of the signal, how fast it's delivered or how often the signal is delivered in nanosecond bursts of energy. And the intensity is as the machine is turned up, you have more energy and you feel it more coming into the tissue, or see it more going into the tissue of the animal. The slower the clicking, the higher the intensity, and the lower, if you will, or the slower frequency that's being delivered. Okay, let's see. Terry, hello from Oxford, Michigan. Let's see. Analog and digital always change things up. That's correct, Maureen. Thank you. Can you also touch on the higher intensity, on how the higher intensity helps more, or does it? Okay, so let me cover a couple of things there. If you go back and you look at older studies that were done 10, 15, 20 years ago, whatever, utilizing PMF, almost all of them were done with low-powered equipment that you couldn't necessarily feel the energy going into the body. So those would be low voltage, low power device, low voltage, low frequency devices. And then what happened when I became involved, what I learned and what I was doing with the animals that I was dealing with is the higher intensity, the stronger intensity that we were using provided results more rapidly. And that's what everybody wanted. I want to ride my horse in 2 hours and I want it to perform better. I want it to have a better range of motion. And so we were able to treat that animal one time and they could get on it 20 minutes later and go ride and have a better result, better range of motion, better attention span, all these types of things that they were looking for, that the higher intensity devices provided us. And so your question is, if I can find it here, let's see. How the higher intensity helps, or does it? It does help. It provides a more rapid result. And that's why you see a lot of devices that are low voltage, low frequency devices where they talk about treating it for an hour, put it on every day for 30 minutes, put it on for an hour, do this or do that, and you'll see your result that you're looking for in 2 weeks. And I'm not saying that that's a problem, but I'm just saying it sometimes, even with low power devices, sometimes you can put them on and have an immediate result. That's wonderful. That's what you want. But you don't always get that. So with a lower power device, when you see them on the marketplace, the treatment times will be an hour, 30 minutes, daily, whatever. The high intensity or the stronger intensity allows you to obtain that result more rapidly. Now, what we found in various studies that we participated in Cuba, and studies that have been ongoing in the United States, is that they're showing the efficacy and how the low power machines with the medium power device, that would be like the Soul or the semi devices, up to the Max and the Julian devices, where they have a higher frequency, to show that the healing properties are really the enhancement of the healing properties are very similar across the board, whether you're using a low power device or a higher power device. The difference being the length of time that you have to treat. I mean, when you stop and think about it, I can sit down in the morning is when I do this, and I will treat my knee, because I'm still working on making sure I stay with my knee, because I have a tendency to want to do things to make it hurt, because I'm not letting it heal the way it should be. But it is healing. I mean, it's much better. I'm back to rowing now. I like to row. And so I'm doing that. And I waited for a while to where I knew I could do it comfortably. But I can treat my knee. I treat the back. I put my head back, and I'll do it on a very low setting to treat my head and brain, if you will, to keep things hopefully functioning well. And then I'll treat my prostate, and I'll do all of that in about 30 minutes. So I don't have to do it for an hour on one area, or do this or do it. So I can do it very quickly. If I don't have 30 minutes, I want to do 5 minutes on my knee, or I want to do 5 minutes, I can do that and still get very comfortable results, and get what I feel to be a more rapid result or completion of what I'm looking to accomplish utilizing the therapies on myself. And so that's the primary difference. The higher intensity gives you a more rapid result, which is what people have been looking for in many of those types of situations. Let's see if I got anything else. Have a dog with epilepsy. He's gone 7 weeks without a seizure, where he was having seizures every week. I am happy with the results so far using MagnaWave and my CBD. Okay, Leilani's writing this, but hoping that it keeps going. However, there is a specific time for each treatment for seizures when it comes to animal. However, is there a specific time for treatment for seizures when it comes to animals? Leilani, I don't know if you're talking about length of treatment time. Really, I would not concentrate on trying to do 15 minutes or anything like that. For years, the standard treatment times have been 3 to 6 minutes for a given location or a given area. So I think you'd be sufficient in doing that. Now, if you're treating a back issue at the same time, you may go a little longer on the back issue. And what are you doing? You're improving the blood flow to the entire body of the animal. So you're working accordingly, but it can be very beneficial as an aid. We've read and seen, and many doctors have talked about helping with seizures. No specific time. Just regularity and consistency is so often the key in those types of situations. Okay, let's see. First, can MagnaWave help sinus pressure when it's there, and pressure from a barometric pressure, if you will? I've tried to get sinus pressure headaches when it's about to rain. Second, what about hypertension? Okay. Can the MagnaWave be beneficial for sinus types of situations that you're dealing with your animals or your clients, or whatever the situation may be? And most certainly, you can help the oxygenation, the blood flow to the area. You can help pulse the area to maybe break things up if there's some sinus congestion that you're dealing with in those types of situations. So it's been talked about. There are studies, if you want to go see how PMF's been used with sinuses, there are studies that have been done over the years to where it has been used successfully in those types of situations, and studies around the world, and various studies available. Do I know of a device that's been FDA approved for sinus type of clearance and those things? Not that I'm aware of at this juncture, but that's certainly an area that I think people will begin to address as more and more devices become more involved with the FDA and procedures accordingly. The question is then, with hypertension, high blood pressure, those types of things, PEMF has been shown to help reduce blood pressure. Quite often when a client receives a PEMF treatment, the blood pressure in fact drops a little bit. So that's always something to be careful about, or certainly that you're dealing with your animals about. You don't want the pressures to drop too much or so forth. But it's relaxing, so it's very relaxing to the client. And which, if you're relaxed, you go to the doc and they take your blood pressure and they'll sit there and they'll do it twice. Why? Because the first time, quite often, you're thinking, oh my God, they're going to take my blood pressure. And I hope it's not too high. And I take my medication or did that. And all of a sudden your blood pressure's higher. So they say, okay, let me do it again. And then it's boop. It's where it's supposed to be, or where you would anticipate that it was going to be given your current condition or whatever your medication might be. So you have that same type of situation. So when something is relaxing, or you're more relaxed, your blood pressure would be more in check and the way it should be, or the way that the doctors would want it. So I hope that helps as you think about this particular usage with your clients. Kathy, you're welcome. How do you recommend using MagnaWave to help someone with persistent post-nasal drip? Well, if you want to help the area, that's a great question. So you might be talking about a sinus issue, or talking about an allergic issue, or something causing that. You have a buildup, it accumulates. So what would you do? You'd want to help it be moved. You'd want to help it be cleared away, just much you might like to do when you're talking about inflammation on the hip of your horse or in the shoulder, and you want to get rid of the inflammation to calm what's going on. And so you move it, you get things into the lymphatic system, you clean up the area and help it be a better road flow, if you will. And we've talked about that. Have a situation on the highway where there's been an accident and the rubbernecking continues to slow down the traffic when everything's been clear. So we work very hard to clear the area. So you want to clear around the area to help things be pushed to the lymphatic system that need to go there and help clear it up. Can I sit and say categorically that it will do that? Well, it depends on what's causing it. If it's a persistent problem that's being caused anatomically, or something that they need to deal with medically, then you need to deal with it medically. But can you enhance what's happening in order to help clear things up? Most certainly. Always follow the direction of your doctor as you move forward in those types of situations. Mary, you're certainly welcome. There you go. Leilani, thank you for responding. That's great. Any other questions? Post them in the chat box and I'd be happy to have a look at them and answer them. Let's see if anyone has approached to make a phone call or to talk to me. Nope, everything's quiet on that side. So we're certainly glad to be here. Wow, time is flying. I know we started late, but it's almost the top of the hour already. 502-414-3436 if you'd like to talk with me, and I will give you a call and we can have a conversation about whatever it is that you would like to talk about today. A lot of things going on. I know a lot of folks are getting ready for the holidays. It is that time of the year, and we're excited. I always enjoy the holidays. Good time to be with friends and family and clients and customers. And so take care of your customers, wish them a happy holiday, give them a card, do something to show that what you're going, that you're concerned about your customers and you want to thank them for how they've utilized you in the past year. So please do that. Always, when you talk about what I can do to help build my business, you want to make sure your customers understand your appreciation and how you enjoy working with them. So certainly, I'm not saying you have to use our cards, but give your customers a card, reach out to them in some fashion. My goodness, just saying thank you and Merry Christmas or Happy Holidays, whatever your comfort level is there, or what's the best way to approach it. Do that. Make sure that your customers understand that you're very appreciative and you're wishing them a happy holiday as well. Okay. Any other questions? Simply post them in the chat box. I'll continue to take questions as long as we have them. If you'd like to talk with me, give me a call, 502. Where is that number here? Let's see. Oh, having trouble with the signal. Maybe there's signal issues, but maybe not. 502-414-3436. 414-3436. I will simply give you a call back and we can talk further about whatever it is that you would like to discuss. Let me check my phone lines one more time here to see if anybody has sent a message or chimed in. Nope. Okay. So let's see here. Nope, nothing else there. Well, I do want to hang for another minute. Remember, MagnaCon's coming up. It's going to be a great year for MagnaCon, downtown Louisville, overlooking the river. Be a lot of fun. Buy your tickets now for MagnaCon, and if you buy them before the first of the year, you'll save $100 on your registration. We will let you know when the room block is available. So we'll send you an email. If you've purchased tickets, you'll certainly get an email saying, call the hotel, book your rooms. If you want to wait to book your tickets, you can do that. And we'll let you know through the MagnaWave corporate site and the practitioner pages when the room block is available for you to go. Certainly utilize the video books. They're very interesting, and people are buying them and using them. And it's just a great tool to help you do. There's a picture of the video book. Tony's put it up. It's really an exciting piece and can be very beneficial. You can use the videos that come with it by discipline if you want, or by type of clients that you have, or you can supply, make your own videos and load them into the video book so they're very personalized for what you want to do and how you want to use the video books. Okay, let's see. Cherry eye in dogs. I've been treating our Cocker Spaniel. Definitely see a swelling going down each time. Want to know what your experience has been with it, as I just started treatment with her. Well, certainly if you're seeing the inflammation be reduced and you're seeing a better comfort level in the animal, the secret would be, what I would recommend, it's not a secret, but what I'd recommend is consistency, because sometimes you get in that type of situation and one or two, one or two treatments will make things more comfortable or better. 5 or 10 treatments will maybe get it to a point that it's no longer an issue. So consistency would be the key. And as you know, we've always maintained treat as often or treat as long as you continue to see improvement or continue to see things function improve, and then treat as often as necessary to maintain the function that you've achieved, and whatever level that is. Sometimes you take a situation to where it's not a problem anymore. Sometimes you get it to where it's able to be treated once a week, and things are good in those types of situations. So that's always something that's important to remember. You know, I was reading an article this week talking about inflammation, overall body inflammation, and how much of a role it plays in our overall health and in the overall health of your animals. So that's a situation where you might sit back and look, okay, well, I need to do this for 2 weeks, and then I'm going to do it once a week, and then I'm going to do this. It's good, and you can always talk about this to your clients. It's very good to continue to treat, so they have good blood flow, they have good oxygenation. It just sets them up to stay healthier, and you certainly want to strive for that as you're working on those types of situations. So treat as often as necessary as the situation continues to show improvement, and then treat as often as necessary to maintain. Even if it goes away and it's not being an issue, treat occasionally just to keep everything flowing and moving and the inflammation in the body of the animal at a minimum. And then overall health will hopefully or stay improved or stay where you want it. Let's see. Maureen's got her MagnaCon ticket. That's cool. Just bought the full body mat. How long do you treat with the full body mat? I would treat typically, again, 15 minutes is a maximum type of treatment. But if someone wants to lay, or you want to have your animal on the full body mat for 30 minutes to provide some comfort and relaxation, that's fine. That's great. Do you need to go an hour? No. Do you need to go longer than 15 or 20 minutes? No. You can get good relaxation, good blood flow for your client by simply approaching it in that fashion. It doesn't take a longer time. Now, if you have a situation where you're going to be running it low, I've got a question that just came through on CastBox that I'll take a look at here for us. And so you want to have a look at that and stay with that as you're treating. So treat consistently to help the inflammation be down and to maintain the process that you're looking for. Okay, will there be any sales coming up on equipment or attachments? Great question, Kathy. I don't deal with that part of things. I do know that Elaine and Cameron were meeting today at lunch to go over some pricing issues and some packages and products. So there may be something coming up for the first year. I'm not real sure, but call your customer service agent or call your product specialist if you have someone that you've dealt with, and ask them the question, is there anything going on? And they'll certainly tell you, because they like that, that you're asking, and you want to keep up with that. Due to looking forward to 22 MagnaCon. Rob, thank you. I'm glad you got your tickets. That's exciting. We always look forward to the folks that are there, going to be there, and it's just a great time. I learn so much each year when I go from you, and I said this last year at MagnaCon. It's just been so amazing to me to watch and to listen to the questions. Someone will ask, I may be on stage, or Elaine may be on stage taking a question, or a panel may be on stage, and then all of a sudden we give an answer, then somebody in the audience has got a more direct answer, has had and more experience with a particular indication that we're talking about, and they'll provide an answer, and the whole place will learn from that. So it's just incredible. And so the depth of doctors and specialists and people that'll be with us this year is increasing, and we certainly want to do that as well. So it's just a great time, and we look forward to learning and getting your questions answered. Any studies of MagnaWave and cancers? If PEMF oxygenates cells, does this oxygenate cancer cells as well? What they found doing studies in animals and dealing with cancer, there is a device that is recently FDA approved for glioblastoma brain tumors. And what it does is it helps the brain tumors develop more slowly. It retards the development of the tumors. In some cases, it can reduce the size of the tumor. When you talk about oxygen and you talk about what happens in cancerous animals and in various states of those types of situations, that if you can improve the oxygenation, one thing cancer does not like in animals is oxygen. They like the lack of oxygen, and they like the dormancy of no oxygen or little oxygen movement. So if you can improve the oxygenation, you can in fact attack cancer cells more appropriately. Do they receive the energy that's there? Yes, that you're supplying. But if you're improving the army that's going to help provide health and wellness to the animal, that's a good thing. And so that's where you want to talk with the veterinarians and the doctors that you're dealing with these types of situations. Around the world, there have been a lot of different studies with cancers. Again, there is a device now, PEMF device, FDA approved for glioblastoma brain tumors, that they're seeing wonderful results. Are they seeing healing of the cancers and disappearing of the glioblastoma tumors? I'm going to say, from what I've seen and read, no. But they're seeing better quality of life, longer quality of life, reduction, less pain, more comfort. And while then they supply other medications to maybe do more. And as you know, chemotherapy goes in and attacks the cells around the cancer cells, so the body's oxygen can then go attack the cancer cells and do the job. The chemotherapy does not actually, or at least my understanding is, to not actually kill the cancer cells themselves. It allows them to become exposed to the better oxygenation of the body. So that's the situation that I'm familiar with in animals. There's been a lot of studies done. There is the new device, the Optune device for human brain tumors, and the results that they're getting there are very promising and very encouraging to those who have experienced those types of situations. Hope that answers your question and how to have a look at it. Cancer is an area that you really want to deal with your docs and what they're doing and what they're saying. And that's an area that in the PEMF world, we've always stayed away from. We've always gone with what the docs want to do. But as you see things changing and people better adapting to situations, you'll see a lot of stuff happening. I do know that there's cancer clinics around the world in other countries where PEMF is more readily acceptable and more readily part of mainline medicine that use our devices and other devices regularly for what they do in those types of situations. So there's a whole conversation there for you to have with your doctor that you're dealing with when you're dealing with your animals and clients and so forth. All right. Great sale on the full body mat right now. There you go. So Ashley's familiar with something that's going on with the full body mat and the travel mat. So there you go. Treating a border collie who has a sarcoma feels much better. How often should we treat him? Well, again, you want to deal with your doctor what their medication is and how often. You could treat regularly. I mean, if you're treating this situation in the animal, you could treat it daily. You could treat it a couple of times a week, whatever's comfortable, whatever the doctor understands is going on. Talk with your doctor what the medications they're using. I know Dr. Marty has used a lot of vitamin C IVs with the animals. And when he was practicing in that situation to increase the vitamin C of the body, then they would use the PEMF to enhance what they were delivering to the body and then getting the results that they were looking for with tumor reduction and in many cases making them more operable. He did a lot of cryo surgery where he would use freezing on the areas. And so that's something that you can approach, but always talk to your doctor and understand what they're wanting to do and how you can maybe be a benefit with them or to them. Okay. Let's see. Oh, snowy Minnesota. There we go. Hi from snowy Minnesota. It's not snowing here in Louisville today, but they said it might. So we'll see. But how are you? Can maybe, let's see. Kelly asks, I'm late, but I'm here, and how you can maybe be, she needs to finish the question, and I'd be happy to have a look. Let's see if anybody is approaching for a call. One quickly here as we get, nope, everything's quiet on the call front. All right. Good afternoon from Massachusetts. Okay, great. Appreciate you all being here. Time is moving along. It is at top of the hour, and I'll stay for a couple more minutes. I was late. I was almost 20 minutes late. So I'll stay as long as you have questions for me that I can answer or provide for you. Let's see. Farshid asked the question on CastBox, do you connect electrically throughout the body? Well, basically what happens, Farshid, is that we create a magnetic field that will totally penetrate the body. The field is generated through a copper coil that has an electric signal going through it. So we have a current that comes into the machine. It's converted to a DC current, and then it passes through the coil, which creates a magnetic field. We don't actually conduct electricity. We do not provide an electrical signal to the body. We provide a magnetic field throughout the body that helps the oxygenation of the blood, helps the blood flow, allowing the body to be in a better position to heal itself. Great question, Farshid. I appreciate it very much. Are you the brother of Hans Zimmer Inception? No. Great question. My name is Ziemer, not Zimmer, but that's a great question. Let's see, that's from Siklander, and appreciate the association there, but no, I'm not the brother of Hans Zimmer Inception. So there you go. Great. Have a couple questions today that came through on CastBox. That's always exciting to see that developing. Okay, let's see. Sabrin asked the question. Let's see. Kelly said last half wasn't supposed to be there. Okay, there we go. I am a brand new practitioner, still awaiting the arrival of my Soul Pro. During my learning, I am struggling to find a good rule of thumb to decide how often to treat different animals. I hear every day, a couple times a week, once a week. How do I know what is best, or do I let my clients decide? I'll give you what happened when I first started. I would be able to go to a barn and I would treat a horse, and they would get on the horse and they'd ride it and they'd come back and they'd say, my goodness, this horse is better immediately. Do the next horse and do the next horse. And so at that time I was doing show horses, and I was also working at Churchill Downs and the various racetracks in the area. And I'd go to Gulfstream in Florida but I would, it was new and it was exciting and they wanted to use it. So in many cases, if we had a horse show going on and wherever it was, I would treat Wednesday, Thursday, Friday, Saturday, and Sunday morning, and to keep on a particular horse if the horse was competitive, and I do, that type of thing. Over time, we learned that you could treat a horse, treat the horses on Wednesday, they'd perform fine on Thursday and Friday, and maybe they'd do another treatment on Saturday to get them through the weekend. If the horse had issues, we would maybe treat them every day, or maybe we'd treat the overall body on Wednesday or Friday, and then treat the feet on Saturday and Sunday because they're jumping and they're doing this. So every horse is different. But I can certainly say that the rule of thumb that you want someone that you'd like to have a client get into as far as how they're moving forward with their treatments would be to treat maybe weekly. In some cases, they may treat an animal twice a week. And we learned over time that you could treat a horse on Wednesday and it may very well carry it through the entire show. Whereas the next horse may need to be treated Wednesday and Friday, or Wednesday or Thursday, and then treated again Sunday morning before the Grand Prix or before whatever their situation would be. In the racehorse world, we quite often would treat the horses in the barn weekly. We might do this horse twice a week, this horse once a week, or each horse the day before the race. We would quite often do that. Many tracks, many states don't want us treating the day of. Some don't have that rule, but the veterinarians would prefer that we follow that type of rule. So it's very normally in a racetrack environment, we treat up to the day before. Quite often they'll maybe do a chiropractic adjustment 9 days out, or they'll do a shockwave treatment 9 or 10 days out, and they'll use us every other day up until the day before the race to keep things going, to keep the circulation going. So there's really no rule of thumb, except I would say that if you're going to a barn and they've got show horses, or they've got horses that are having situations once a week, they'll learn and they'll understand. So yes, your client at a point is going to tell you, but you've got to educate your clients that you want to keep the animal healthy. You want to keep it performing the way they want it to. And they'll see that. That's the thing that's really neat. And that's what happened to us at the beginning was, as I've said, I could treat a horse, the rider would get on it, go ride, come back and say, wow, there was a difference today. And of course, they'd want that tomorrow as well. And we did that. And until we realized that I could do it, a couple, 2 or 3 days prior to the event. Then the situation became, what can we do after the event? And now we're into the therapeutic side of what's going on. We want to help the recovery period. We want them to recover more comfortably. We want them to recover more rapidly, so they recover and then they can go back to the training schedule that they're so used to, that you like for them, and like to have them in that particular type of training schedule. So then recovery became important. And so you have an animal that would compete on Sunday or perform on Sunday or race on Sunday, and we would treat it Monday and Tuesday to help its recovery period. Then you'd lay off until it came back to the next time of competition, and maybe come again the day before the competition. So it's a situation that they'll see the improvement, they'll feel the improvement as they ride the animal, as they work the dog through the agility trials or whatever they're doing. The pigs, they'll have a better gait when they go to the ring. Same thing for the cattle, they won't be as stressed and what's happening. So you have all of those types of things, and they'll see it, they'll understand it. Talk to your practitioners. If you're in a particular area, if you're working with dressage, and understand what some of the practitioners who are in dressage, how they approach their clients, how they approach the animals. And again, I'm close to a lot of different people in different disciplines. And again, each horse is different. So this horse may get it more often. This horse gets it once a week. This horse gets it once every 2 weeks. So your clients will help you ascertain what that is. I can't tell you that it's important to do it once a week. That works. And as a rule of thumb, that'd be a good place to start. Hey, we have these animals, let's do them once a week and see how they do, because they'll see that. They'll be able to see, well, we treat these animals and they hold this well. I train them this way, and they go right through the training and right through the competition part of the arena. Whereas again, the next horse needs to be done a little differently. Hope that helps. Just be confident. That's the key. Be confident in what you're saying and how you're talking to your customers. Don't approach them, well, I don't know. Whenever you think we should treat it. No, start with a regimen. Let's treat all of the horses once a week. And then you can ride them and you can see how they hold, how the adjustment holds, and we do that a lot with chiropractic, where they'll do the chiropractic adjustment, and then we'll treat afterwards to help them maintain the chiropractic adjustment that they've received, help the inflammation be in check so they hold that adjustment longer, and away they go. So you have those things. Confidence is the key. How you talk to yourself. Let your the video books is a perfect thing. The video books can talk about, will show how it's done, when it's done, and gives your clients a better understanding of what you're wanting to do. Okay, LTC says, I always say that in a perfect world, every horse would get done at least once a week. My personal horses are done 1 to 2 times a day, depending on the issues. Great comment, great way to look at it. Depending on what issues, every couple of days. Long horse shows, we do them every other day. Some sort of consistency is key, whether it is weekly, bi-monthly, or monthly. Absolutely. That's perfect, and that's a great way to look at it. John asked the question, is a Semi-3 powerful enough for a full body mat? It is. You won't feel it as much. You won't feel it on the full body mat, but it is there. The signal is coming through the mat. So look at it like this. A lot of the low voltage, low frequency devices are generating 30 to 50 Gauss on their mats. And you take the Semi-3 that with the paddle or some of its attachments can reach 3,000 Gauss. And if you put them on the full body mat, because of the configuration of the coils in the mat, you may be receiving 500 to 600 Gauss. You're still 10 or 15 times stronger than a lot of the very low frequency, low voltage units that are out there, even though you won't feel it. So can it be relaxing? Most assuredly. And can it be beneficial? Yes. Will you feel it using the Semi-3 on the mat? Probably not. But that's just as it is. But the energy you're producing and the energy that you're putting into the area can be very beneficial to your client and to the animals and so on. Let's see. Oh, come on, Pat. Give away a free machine. You always give away the best prizes. Elaine is far too sensible. Well, there you have it. Yeah, I'll think about that. I'll put that in the mill. I got to have a meeting with her this afternoon. We'll talk about some stuff. That'd be fun. Christmas machine or something. Oh my God. I'm going to be in trouble now. I use the guidelines in the app a lot. Great idea. If you don't have the MagnaWave app, get it. There is a small cost for it because it costs a lot to develop it and keep it going, but it's got guidelines in there for all types of different situations, and they're guidelines. So it's a place where you can read that we've put some ideas together on how to best use the therapy for various situations. And so it's there for your perusal, and it's a great place to go. You can also communicate with your customers via email through the app. You can keep notes on the animals that you're treating and share those with your customers. It's a great place. It's a great item to have to help you with your business and prospects. Let's see. Many in my barn on weekly schedules, couple twice a week. There we go. Maureen shares that information as well. So there are people, as I said, that have standards that they perform and ways that they approach it. And that's certainly there. Once a week, I think, is a good goal for every animal, and do it accordingly. Let's see. A week, not a day. Oh, sometimes twice a week, not twice a day. Understand. Now, in an acute situation, as people do, they might treat it morning and evening, 6 to 8 hours apart, as far as the treatment times to get the energy into the body. But certainly, and I agree. Thanks for the clarification. Not twice a day, every day, normally. Okay. any other questions, post them in the chat box. I'd be happy to have a look at them. So we've been going almost an hour. So we're doing our normal time, even though I started late. I apologize for that. But we did have some extenuating circumstances here this morning that we had to get cleared up, and we did, and everything's cool. You know, when you have somebody coming to the office to do some work and you got to be with them to help them do the work, or at least explain the work, then you just get delayed. But the crew, Tony and Emily and Tony and Chris and everybody at the office, very helpful, and got the message out that I was going to be a few minutes late as we move forward. Okay, I don't see any other questions. Let me check my phone one more time to see. Nope. No phone calls. I guess I'm going to have to give something away to get some phone calls. I'm going to have to do that next week. We'll work on that to maybe get some calls. Let's see. They're talking about the sale that's going on now on the full body mat. So there you have it. All right. I really appreciate you all being here with me today. I've got my camera figured out here. I think finally it's getting used to it. It's a little bit of a change, but it is different. So I'm not looking up all the time. It's just I'm kind of a gadget type person. If I can get a gadget to help me do the gadget, then the gadget's pretty cool. So I'm going to get the gadget. And, you know, it's kind of a shiny object. Shiny object goes by, I'm in trouble. And just ask Dee Dee, and she'll tell you all about how I get in trouble when it comes to shiny objects or new things to talk about and think about. Oh, it's Christmas. Think about that. Gadget time. Anyway, sorry. I get going. Thank you for being with me. I certainly appreciate it. We're very thankful for all of you as practitioners, as customers. We want you to have the best holiday that you can have. We want you to certainly enjoy your family and your friends and have a good time. I want you, as always, to wave on to better health. Go all the way with MagnaWave. Have a great week, and we'll see you next Tuesday. Thank you for joining me. Bye-bye.